Always true.
Mpox, once confined to Central Africa, has again become a global threat. In 2022, the World Health Organization declared a global health emergency as Mpox spread to new regions. The outbreak was first linked to sexual transmission. Now, 2 years later, Africa faces a new wave, with 70% of cases affecting children. This variant transmits differently, but exactly how remains unclear. Yet Africa again seems to be at the back of the line for vaccines and resources, with a slow international response marked by the same inequities as during the COVID-19 pandemic. With both the World Health Organization and Africa's Centers for Disease Control and Prevention declaring public health emergencies, the stakes are high. This is a test of global solidarity. Dr. Matshidiso Moeti, WHO Regional Director for Africa, has been at the forefront of response efforts. Today, she discusses the challenges of global health governance, vaccine inequity, and the need for a new public health order in Africa. Dr. Matshidiso Moeti, World Health Organization Regional Director for Africa, talks to Al Jazeera. Dr. Matshidiso Moeti, WHO Director for Africa, thank you for talking to Al Jazeera. Let's lay out where we're at, first of all. What's your understanding of the current status of the Mpox virus in Africa as we speak?
Yes. First, thanks very much for the invitation. I think we can summarize that there are several outbreaks going on added to endemic Mpox in some countries, particularly in Central and some West African countries. Overall, since the beginning of this year, there's been just over 15,000 cases, suspected cases reported, almost 4,000 confirmed, laboratory confirmed, again, underlying the challenges with laboratory supplies. But I would say that the outbreak that is of most concern, that has triggered the decisions to declare a public health emergency by both the Africa CDC and WHO, is happening in the eastern part of the Democratic Republic of the Congo, in Kivu, which has spread to a number of countries that have never had cases of Mpox before. Burundi, a country where this virus has spread geographically fairly widely. Rwanda, where it's mainly confined to the capital city. Uganda, where it has now extended to Kampala, and one case has been detected in Kenya. And of course, we know that a case from the Democratic Republic of the Congo arose in Sweden as well. So the main, I would say, the epicenter of the most challenging situation is in the Eastern DRC, and that is where the focus is. But of course, a number of other countries are involved in other outbreaks, which overall then constitute the Mpox situation in Africa. It certainly deserves additional attention, and it was time to declare these public health emergencies.
Right, because, Doctor, I understand there are three branches of the Mpox virus, and it is clade 1b that you're talking about there in the east of DRC.
Yes, it is clade 1b, which is spreading in the context of an area of insecurity, mining, intense population movement from the surrounding countries. And we know that it's spreading not only in the normal ways of skin-to-skin contact from the lesions, but also the sexual transmission going on there, and possibly even vertical transmission, because there is a significant number of young children affected, as well as mainly young adults in that outbreak.
And this strain, is it more deadly? Is it more virulent? Is it more contagious than the others?
Well, certainly, I think we're still trying to understand the strain. It seems to be spreading more easily and also able to cause more serious clinical manifestations in those who are affected.
Okay, and as you say, a primary cause of infection has been as a sexually transmitted disease, but it can also then be transmitted to family members in close proximity, right?
Yes, it can be transmitted in the usual way. People with lesions and fluid from the lesions can infect people in the family who have close physical contact, are touching the same surfaces, might themselves have lesions, as well as through body fluids, including through sexual contact.
So as the position is at the moment, as the situation stands, how much of a threat do you think Mpox is right now to Africa?
Well, Africa is increasingly interconnected. We know. Certainly, the spread that we've seen in that sub-region, if you like, in the eastern part of the DRC, means that it can spread even further in the neighboring countries. Those are the highest at risk. It can spread further. It can also spread through international travel. We live in a world where we travel a lot. People get into aeroplanes, as I was saying. There actually has been a case in Sweden from that outbreak, and we just learned the government of Gabon also indicated that there's a case of somebody who had traveled to Uganda who went back home to Gabon and who has been diagnosed, and we think it's from this outbreak. So in this global interconnectedness, we can expect, as we've seen with other outbreaks, that people can be traveling locally, regionally, and internationally. That's the risk.
Right. So given those challenges, how effective have the containment efforts been so far, and of course, the vaccination programs?
I mean, what I would say is that we're at the start of following the declarations, really scaling up the preparedness and the response in the countries. We have worked with the governments and also in partnership with the Africa CDC to help the countries to update their plans, develop detailed plans, and we're in the process of compiling a regional plan, focusing very much on the most severely affected countries, those highest at risk. We are then looking at mobilizing the capacities, developing the capacities in the countries, mobilizing international support by way of financing, and of course the key tools that are needed for the outbreak, including vaccines. As well as diagnostic supplies so that we can track and follow better and improve the surveillance and know where the virus is going. So I would say that this is work that's very much in progress, very rapidly in progress. We're aware that the availability of vaccines is a huge challenge. There are 2 vaccines at the moment that are possible. There is one being that's produced by the Bavarian Nordic company, where at the moment we understand there are about 500,000 doses available, and there's potential, if there is a need created in terms of financing for countries to be able to scale up the supply of vaccines by this company. And then Japan also has a vaccine that they have developed, which is available for donations to countries. What is really needed, we know that following the global outbreak that took place in 2022, mainly among men who have sex with men, there are other countries that have supplies of the vaccine. So what we would really like to recommend is, building on our experience with the COVID-19 situation and the challenges that African countries had, getting the supplies that they needed, that we organize donations, that we also mobilize the kind of resources that are needed for countries to be able to buy vaccines and trigger that increased production of the vaccine supplies. I would say that WHO, working with other partners, including Gavi and UNICEF, has a mechanism of emergency use licensing that triggers additional resources being allocated by these partners in order to enable countries to have access to vaccines.
Is it clear, Doctor?
You're
Sorry to interrupt, but is it clear just how many vaccines there are out, how many doses there are out there that there are available at the moment that could be donated, and those that you have access to already? And then how many more are required? I mean, if you could wave a magic wand and say, we need this million number of doses, how many would that be?
I mean, at the moment, we know that there are about 500,000 doses available of the MVA vaccine. That's the one that's produced by this Bavarian Nordic company. and that they are able to produce an additional 2.4 million doses if they find buyers, that is a market. And for next year, an additional 10 million doses could be produced if there is a firm procurement mechanism, the resources are available for countries to be able to buy this vaccine. So this is the Bavarian vaccine. And then the LC16 vaccine that's produced in Japan is not commercialized. It's something that's being done on behalf of the government of Japan, and they have apparently a very considerable stockpile of the vaccine, which can be made available through donation mechanisms working with WHO. So we are working with Japan on that.
All right, so getting the stocks of vaccine built up, that's a critical thing. That's an important issue immediately to address. But then also, and something you're already experiencing, I'm sure, distribution is a major concern, especially in remote parts of Africa and the rural areas and so forth.
Yes, absolutely. I mean, I have to say that African countries have extensive experience in carrying out vaccination campaigns, even to remote areas. But that always entails investing in the capacity to do so, mobilizing additional healthcare workers, community workers, those people that are going to be carrying out the work. So this is the planning that we are supporting our countries to carry out now. We need to define, quantify what is needed in order to be able to not only get the vaccines into the countries, but get the vaccines from the airports into the arms of people where sometimes the primary healthcare system is very understaffed. The logistics need investing in to get the vaccines out there. We need to train people. And I think very importantly, we need to create an understanding at the level of communities of accepting vaccination.
Right, and on that latter point, you're talking specifically, I guess, about vaccine hesitancy and all the misinformation that's out there.
Yes, we learned a lot about hesitancy to accept interventions during the COVID-19 pandemic, but we'd already had experience dealing with this, for example, in the work that we're doing on poliomyelitis on the continent and at the global level. What's very, very important, first of all, is to be working with locally trusted leaders, community people in the places where we would like to carry out these vaccine campaigns. And then secondly, be very much tracking some of the misinformation that is spread around. I mean, one almost has to acknowledge that there is an anti-vaxxer global movement that targets any problem that arises. We saw that very much with COVID-19. So working with local leaders, local trusted people, local communities, we need to create a sense of trust in these tools and monitor and track. And we have a mechanism that we developed, a so-called infodemic partnership in WHO that we used very effectively around the COVID-19, and we are, reactivating that in countries.
For anybody who might be watching this interview now and they're hesitant about taking the vaccine, what would you say to them to reassure them and to encourage them not to listen to all this misinformation that's out there?
I would say trust in the fact that we have used vaccines before to deal with meningitis, to deal with polio, of which we managed to eradicate a wild polio variant. We vaccinate children against measles. At the moment, there is a big outbreak of measles following COVID-19. And we have proof, we have data that can show this, and our wish is to save the lives of people on the continent, save the lives of children who are very much affected by Mpox, save the lives of young people who we need in our continent to develop our families, to look after, to develop our economies, to be as significant role players in our families. Our wish is to save the lives, preserve the health, support our countries to develop with healthy populations. That's what we want to do.
Now, you mentioned the international response. Are you satisfied with it?
We're at the start, I would say, of this process now. I am hopeful, and I think the support that's been declared by the European Union and a number of partners that have indicated they are interested in hearing from WHO, from the African Union, the Africa CDC, more about what is needed. I am hopeful.
You say you're optimistic, but this has been going on for some time, isn't it? It's not as if we're right at the start of Mpox suddenly arriving on the scene. It's been around for a good period of time. This latest round started in 2022, so the response has not been good, has it?
No. I mean, I think the 2022 situation was a global outbreak that affected many countries and not very many countries in Africa. I think what we have in Africa is a situation of endemicity, of which not much international notice has been taken in the past. I will state and acknowledge. And then we have now an acute situation, a growing situation, where we really do need the international community to recognize that this is a problem, health problem that's been growing progressively over a number of years. Now it needs a very different scale of response. And we need the kind of planning, the quantification, and readiness on the part of international partners to respond early with financing, of course, with the countries themselves investing in what they can do locally, but with financing, with tools like vaccines, supplies like diagnostics, to really make a difference quickly, because African countries have many, many disease outbreaks. I mean, as we are speaking now in the region, in Western Central Africa, we have about 90 disease outbreaks going on, public health emergencies going on at the same time, out of which about 70 are outbreaks of different types, which have a significant socioeconomic impact on Africa, which is sometimes not quantified and stated enough. So we're really hoping for a different response in terms of international solidarity.
I just want to read you a quote from Dr. Berry Okereke, who's with the Global Health Programme at Chatham House, who said, "The consequences of failing to respond robustly to this could be severe, potentially leading to the increased spread of new and more dangerous variants. The risk of a failure to act now is not just a risk to Africa, but to the rest of the world." It's a stark warning, isn't it?
It is, and I agree with it completely. You know, as we saw with the 2022 outbreak that went global very, very quickly. In fact, it was a very dramatic increase. So, you know, we live in such an interconnected world. And we need to learn as well from the experience of the COVID-19 pandemic that went everywhere in the world, that something like this can rapidly spread. As I've already said, there's been one person who traveled from the DRC to Sweden that's been contained. But, you know, it only needs a variant to change the way that it behaves, that the way that we live globally in the world today can trigger something that can affect other countries. So not only in terms of solidarity, but out of self-interest, protection for their own populations, we anticipate and really plead for this international support for the situation in Africa today.
But shouldn't this kind of international support have been mobilized back in 2022? Because then presumably we wouldn't be in the position we are now.
Indeed, I think the situation in 2022 occurred while we were also dealing with COVID-19, or towards the end of COVID-19, and the pattern of spread. Of course, we saw cases in South Africa, in Cote d'Ivoire, and in a couple of other African countries. But you know, you are very correct. We need from every event to emphasize the interconnectedness of the world. I think you are aware of some of the discussions and negotiations that are going on internationally now on pandemic preparedness as a global community, what we need to do together. And those discussions are extremely important because they highlight some of the issues of who will invest, who will benefit, how we are equally, or how we share the risk, and how we then need to share the response, and some of the rules that will determine how we behave as countries and continents.
Do you think, Doctor, that the lessons of inequity that were very apparent in COVID-19, dealing with the COVID-19 pandemic, have been dealt with, have been noticed, have been acknowledged, have been learned?
I think it's a work in progress. They were certainly acknowledged in discussions. They now need to find their way into mechanisms that can be predictable, where we can explicitly acknowledge that we share a common fate, and that that knee-jerk reaction of protecting our countries by closing our borders to those that are affected by something and keeping them out really doesn't work, and it certainly did not work. So there are discussions going on at the international level now where we are advocating very strongly that these principles of equity need to be central in any discussion and any agreement that is reached at the international level among member states of how to collectively act when there are disease outbreaks of this nature.
Is it possible?
I mean, I must say.
I was just going to say, is it possible to say, what improvements have been made in preparedness and response within Africa since COVID-19?
Yes, I think quite a lot of investment has been made in improving the capacities in countries. For example, we have a flagship program, as we call it, in our emergency program in WHO in the African region, where we have supported countries to carry out some training of the first level responders in the countries. Very often in African countries, what happens, there is a disease outbreak. We have global mechanisms of responders that then are flown in to support the national system to respond. So we are seeing our countries recognize the need to build their own capacities. We're supporting that together with the African Union. We have helped them to establish public health institutes so that you have a local institution where you have the staff who are ready, who are trained to lead and coordinate the response. I believe as well at the political level, following the COVID-19 pandemic, the mechanisms that were established in the African Union, we have a political mechanism at the level of presidents, which enables a discussion at that level of those leaders about there's something happening here, we have to do something, and we have to work together to look for the support, look for the resources, invest to address these situations. So I think the situation has changed. I mean, we've seen as well since, for example, the Ebola outbreak in West Africa and the progressive investments that have been made, that our countries are capable of knowing that there's an outbreak happening and closing down that outbreak much more quickly than was the case before that. These investments progressively have to be continued so that the countries are equipped and ready according to the standards that WHO defines.
How would you assess the collaboration between the WHO and national governments? And how are you ensuring that the monies given to national governments gets to the people in terms of healthcare and isn't siphoned off in corruption?
Yes, that's a very good question. Of course, there's a lot of variation in the countries. I would say that the partnership and collaboration between WHO and national governments is extremely good. It is extremely strong. As a regional director, I've been able to have access to government leaders at the highest level. We work very closely, of course, with the ministers of health and the ministries of health. We have 47 countries that I oversee in the African region, and our country teams led by WHO representatives work very, very closely with governments. And we have worked to advise them, working with other partners, help them develop their national strategies, help them also develop their mechanisms for ensuring that they monitor and improve accountability for the financing that they are getting. Yes, it's true that sometimes when there's large amounts of money, particularly when there are campaigns being carried out, we do get money leaking. What we are helping our countries to do is really, improve their systems for accountability, for monitoring where money is going, and for taking action when wrongdoing occurs in the use of funding.
Director, your term as head of Africa WHO ends next year. What's been the most challenging aspect in your time?
It's been a very interesting experience. I was elected and started during the West Africa Ebola outbreak. We, of course, work very hard following that, learning the lessons, investing in systems. So I would say that the biggest challenges that our continent or our region faces is, of course, the adequacy of investment in health. We really do need more investment by the member states, and we appreciate the international investment that has been made in Africa, which we are starting to see leveling off. And what we'd like to see as well is more integrated ways of using the funds that are available more efficiently in order not only to deal with disease outbreaks, but to have health systems that reach the most peripheral level. You mentioned people that are living far away from capital cities, so that we have primary healthcare systems, which even if the clinics are mainly manned by nurses, are progressively being improved in terms of their capacity to deliver basic healthcare. We need much more emphasis on prevention, health promotion, so that the population itself understands what they can do in order to look after their own health. And we need much more coherence of the way in which international support financing is provided to African countries. And I'm very happy to see that there is a mechanism that's being put in place by some of the global health initiatives to bring together their funding so that it's less fragmented and it supports the health systems in countries. Of course, one of the biggest challenges that I've observed is the human resource situation and the migration of healthcare workers from African countries to wealthier countries where they can admittedly earn a better living. One of the things that we have done some months ago is to have a charter adopted by African countries with international partners that will really establish some principles of how to work together to minimize and reduce the very dramatic loss of healthcare workers that we're seeing from Africa today. I think some of the things that we've also learned is that I've seen as positive is the innovation that is potentially available within the African continent itself. We have many young scientists, public health experts that have great ideas for innovation. What they need is investment in their innovations so that they can also be part of what is adopted and used in the healthcare systems in African countries. And I'm very optimistic about the way that African countries are taking up their responsibilities for the health of their population, but emphasize that this needs global solidarity, translating into investment, action, working together, and particularly engaging the people. I believe that when people know that they are respected, they have a role to play, they'll do what they need to do as well.
Dr. Matshidiso Moeti, WHO Director for Africa, thank you for talking to Al Jazeera.
Thank you for having invited me.